So how are we determining now what my risk is?
So with melanomas, we look at clinical and pathologic features. We look at the actual melanoma that you had under the microscope. We measure how deep it is. We look at how scary it looks under the microscope, and that helps guide us. We also take into part a number of clinical features, like how old are you, where was it, all these different clinical features that can help guide us and tell us, hey, is this going to be a risky one or is this not? That's how we were doing things more than 10 years ago. With the advent of molecular testing and the GEP testing that Castle offers, we have now personalized that. The DecisionDx-Melanoma test, it takes all those clinical pathological features that we've always been utilizing, and it incorporates your tumor's biology. It looks at the genes of your cancer and it mixes it with your current clinical pathologic risk, and then it will tell you your specific risk of the important questions that we want to know. Is this cancer going to come back? Is it going to kill me? Do I need a procedure like a sentinel lymph node biopsy?
Which is really cool because I think one of the toughest things about cancer is it is different in everybody. So what a path that works for somebody else might not work for you. So just having that information is...
The DecisionDx, the melanoma test, provides personalized information specific to your cancer. This has been around for more than a decade. There have been over 10,000 subjects, 10,000 patients that have been involved in these studies. There's over 50 publications, including ones that include the National Cancer Institute. Thousands of dermatologists and other clinicians have ordered this test. There's been over 150,000 tests ordered to date.